Good morning, ma'am.
Sit down. What is dysgeusia?
Ma'am, dysgeusia is, it means to say that there is altered taste sensation, ma'am.
Where do you get rebound tenderness?
Ma'am, rebound tenderness, ma'am, like when we press on the abdomen and then we release, ma'am. When we suddenly take off the hand, ma'am, the patient will complain of severe pain. This is because of peritonitis. It can also be because this peritonitis, the cause can be acute appendicitis also, ma'am.
What is Troisier sign?
Ma'am, Troisier sign, ma'am, like we see that there is a virtuous lymph nodes, no, ma'am. The virtuous gland is palpable, ma'am. Palpable, hard and fixed lymph nodes in between the two heads of the left sternocleidomastoid muscle, Troisier sign. Ma'am, this could be a sign of gastric carcinoma. Ma'am, it can also be because of ovarian cancer, testicular cancer, kidney cancer also, ma'am.
What are different types of hepatitis virus?
Ma'am, the different types of hepatitis virus are A, B, C, D, E. Ma'am, hepatitis A is the one that is causing it is enterovirus, ma'am. It causes GI infection. So it is transmitted by fecal-oral route, hepatitis A, and basically it is affecting young adults, children, and it is mild severity only. Ma'am, in this hepatitis A, we have vaccination also. Ma'am, coming to B and C, ma'am, and even D, these are transmitted by blood. So it can be sexual transmission or even vertical transmission. And for hepatitis B, humans are the only source of infection. We even have G virus now, ma'am. It is RNA virus, ma'am. G virus. Ma'am, all are RNA virus, ma'am. Like everything is RNA virus except B, ma'am. B is DNA virus. Ma'am, in B virus, ma'am, mainly we have to be focused on the carrier state, ma'am.
What are the pathological changes in cirrhosis of liver?
Ma'am, in cirrhosis of liver, ma'am, we can see that there is grossly we can see micronodules, ma'am. Then we can see hobnail liver, like how there'll be holes in the liver, ma'am. We can see it in the cut section, fibrous septa, etc. Microscopically, we can see again nodular pattern, fibrous septa. Then we can see necrosis, inflammation, bile duct proliferation. So we can see here, ma'am, micronodules uniformly sized. Then we have ductular proliferation. We cannot spot the central vein. There is fibrous septa. There is necrosis also can be there. Then there is fatty change, etc. This is cirrhosis, ma'am. Eventually, ma'am, it can become macronodular. Macronodular means the nodules can become larger than 3 mm in diameter.
What is the etiology of cirrhosis of liver?
Ma'am, it can be alcohol can be a cause, biliary causes can be there, ma'am, like primary, secondary biliary causes, ma'am. Then it can be a virus, ma'am, like hepatitis B virus, C virus, etc. Then there can be heart causes, ma'am. Then there can be Wilson's disease, which is a cause, like metabolic causes, ma'am, copper accumulation. Then, ma'am, hemochromatosis, iron deposit, ma'am. Then glycogenosis, then antitrypsin deficiency, ma'am. Then galactosemia, cystic fibrosis. All these can be caused, ma'am. Then drugs like methotrexate, amiodarone, methyl dopa, etc. Ma'am, amiodarone is used for antiarrhythmia, ma'am. And then other miscellaneous causes can be this Budd-Chiari syndrome, Indian childhood cirrhosis, then autoimmune hepatitis, ma'am, then non-alcoholic steatohepatitis like NASH. Then that's all, ma'am.
What are the eye findings in cirrhosis of liver?
Ma'am, the eye findings in cirrhosis of liver, ma'am, we can have jaundice, so there will be icterus, ma'am. Then there can be anemia. Then bite out spots, ma'am, because vitamin A deficiency. Then Kaiser Fleischer ring, ma'am, very important because a copper deposit, ma'am, will that is in the eye iris, ma'am. Then subconjunctival hemorrhage, ma'am, because they have some bleeding problem, maybe hypoprothrombinemia, because the liver makes lot of clotting factors, and it also is the fat, etc. It will process, ma'am. So vitamin deficiency, which are soluble in fat, ma'am, fat soluble vitamin deficiency. All those signs we have to look for. white hot spots, xerophthalmia. You can see the KF ring here. The copper deposit is not in the iris, it is the limbus of the cornea in which you have this case of Fleischer ring. So this is all happening because there is no ceruloplasmin which actually has to bind to copper. Okay, there is no ceruloplasmin, so all the copper is depositing in the eye, liver, etc.
What is hematochezia?
Ma'am, hematochezia means bright red blood per rectum, ma'am. It can be mixed with or without stools. So, but it is bright red, ma'am. Melena means there will be dark brown blood, ma'am. It will be old blood. Altered blood in stool is melena, ma'am. Hematochezia is actually bright red blood, which is coming from the rectum.
What is Child-Pugh classification in cirrhosis?
Ma'am, Child-Pugh classification in cirrhosis, ma'am, it is to tell the prognosis of the cirrhosis, whether it will be good or bad, ma'am. So, if it is if albumin is very less, ma'am, and if there is bilirubin is more, ma'am, then if prothrombin time, it is taking more time, ma'am. Then if there is ascites, then it is bad prognosis. So if it is greater than 9, ma'am, it's called as child's C, ma'am. C prognosis, ma'am. It is if it is greater than 9.
How lactulose helps in hepatic encephalopathy?
Ma'am, lactulose basically, ma'am, it will produce acidic diarrhea, ma'am. So it will act as an enema or a bowel wash. So the ammonia absorption will be less, ma'am. And then what will happen? It will incorporate the nitrogen within the intestinal bacteria. So the drop in fecal pH, ma'am. So it will help in the growth of these lactose fermenting organism, and it will suppress the ammonia forming bacteria. So it will detoxify, ma'am. And because ammonia was causing the hepatic encephalopathy, this lactulose will help.
You may leave now.
Thank you, ma'am.